Chapter 9 Specifying the Learning Outcomes and Competencies. A range of approaches can be used to identify and define the expected learning outcomes. Who is responsible? The previous chapter highlighted the benefits to be gained from the adoption in education of an outcome competency-based approach. The implementation of outcome-based education is the responsibility of all of the stakeholders. The process of defining the learning outcomes required by the end of the training program is often initiated at a national level. In the UK, the General Medical Council has set out in Tomorrow's Doctors their expectations for the learning outcomes of a graduate in a UK medical school. There are similar initiatives by the regulatory or accrediting bodies in the United States, Canada, Australia, the Netherlands, Saudi Arabia, and many other countries. National examinations, where they exist, may also be viewed indirectly as statements of the expected learning outcomes. Scope and the specification of learning outcomes are now features of training programs for many specialties in medicine, with the learning outcomes or competencies agreed by the relevant postgraduate training body or authority. In the United States, the Accrediting Committee for Graduate Medical Education, and in Canada, the Royal College of Physicians and Surgeons have led the field. While some learning outcomes are specific to the context of a country, there are learning outcomes relating to what constitutes a good doctor that can be shared across geographical borders. In Europe, through a consultation process, generic and subject-specific competencies expected of students at set points in the educational program have been identified. The International Institute for Medical Education in New York defined in terms of learning outcomes what they consider to be the global minimum essential requirements for a doctor, whether in China or the USA. The specification of learning outcomes is both a top-down and a bottom-up activity. A medical school can build on a national statement of learning outcomes with an expanded version reflecting the particular mission of the school. A community-oriented medical school or a school with the aim of qualifying future researchers or leaders in medicine will reflect these orientations in its statement of learning outcomes. The Scottish Medical Schools in the Scottish Doctor Report specified the top-level learning outcome domains, e.g., clinical skills, subscribed to by all 5 Scottish schools. More detailed learning outcome statements varied from school to school, mirroring the differences in the curriculum of the 5 schools. Within each institution, teachers are responsible for specifying the learning outcomes for each course and for each lecture or clinical training session within a course. These outcome statements identify how each specific learning experience contributes to the exit learning outcomes for the school's education program. For the most part, undergraduate, postgraduate, and the continuing phases of education have been organized in separate silos, each specifying independently their learning outcomes and the design of their learning program. Figure 9.1 The learning outcomes and the different phases of education. Phase of education, learning outcomes for continuing professional development. Responsibility in USA is CCME. Phase of education, learning outcomes for postgraduate education. Specialist training outcomes, general training outcomes. Responsibility in USA is CGME. Phase of education, learning outcomes for undergraduate education, phase outcomes, course outcomes, lesson outcomes, responsibility in USA LCME. Phase of education, learning outcomes for pre-medical training, responsibility in USA Regional University. Involvement of stakeholders. The specification of learning outcomes is a key step in the education process, and the range of stakeholders should be involved. This may include specialists in the field, practicing doctors in hospitals and in the community, university teachers and educationists, students and recent graduates, other professions, e.g., nurses, representatives of employers, patients and representatives of patient groups, the public. The need for a wider consultation process is now accepted and is in keeping with a more patient-centered approach to care and a more general move to customer involvement in product development. Many of these stakeholders are now actively involved in curriculum committees. Such collaboration may help to align undergraduate, postgraduate, and continuing education approaches that can be adopted. The specified learning outcomes must match future expectations for the health care we want to see provided. Approaches that can be used to specify the expected learning outcomes include focus group discussions and a nominal group technique, the Delphi technique, a critical incident survey, studies of errors in practice, task analysis, interviews with recent graduates, a study of existing curricular and publications, focus group and nominal group technique. Focus groups with representatives of the stakeholders can be organized to explore the specification of learning outcomes. This may be part of an iterative process. A nominal group method has been used to agree competencies and entrustable professional activities. This is helpful when some members of the group are more vocal than others and when there is concern about some members not participating. The procedure starts with a silent generation of ideas relating to the competencies and EPAS. Those are then shared and discussed. Finally, there is agreement about the competencies to be adopted. The Delphi technique. The Delphi technique is a commonly used and successful way of identifying the expected learning outcomes. It relies on the judgment of an expert panel of wise men. The experts, usually about 20, although it may be more, are required to define the learning outcomes that they consider necessary for medical practice. The circulated responses are then analyzed, amended and added to or deleted where necessary by the participants, and the process is repeated until a consensus about a final list of learning outcomes is reached. The Delphi approach has been used to identify learning outcomes for basic medical education and for training programs in a range of medical specialties. A critical incident survey. Qualified individuals are asked to describe medical incidents that happened to them or that they observed which reflected good or bad medical practice. As the number of individually described incidents increases, the incidents tend to fall into natural clusters and the areas of essential competence in medicine begin to emerge. Blum and Fitzpatrick described a classic example of the use of this approach by the American Board of Orthopedic Surgery. A variation of the critical incident survey is where those regarded as star performers are studied and the features of a star performer are identified. Studies of errors in practice. Errors occurring in medical practice can serve as an indicator of problems with the existing curriculum, and identification of these can contribute to the development of learning outcomes. This may be carried out in collaboration with medical defense or medical insurance bodies. The identification of a common pattern of errors in medical practice attributed to poor communication skills provided evidence that skills in communication should have a greater emphasis in the specification of learning outcomes and in the curriculum. Task analysis. Task analysis requires a researcher to follow a doctor on the job for a week or so and carefully list the tasks that the doctor carries out. The list provides a description of the activities that constitute the practice of medicine and can be the basis for the specification of the required learning outcomes. This approach is based on current practice and tells us what is done by a doctor today rather than what may be expected in the future, nor does it give an indication of the competencies or abilities required to undertake the tasks recorded. Interviews with recent graduates. Surveys of recent graduates can identify the strengths and weaknesses of the existing education program and the stated learning outcomes. This can be done through interviews, focus groups, or a questionnaire survey. Study of existing curricular and publications. A useful starting off point to determine the learning outcomes is to study what is currently taught in a range of medical schools or postgraduate programs and their related outcomes. Analysis of the content of current textbooks and other publications may also be helpful, but should be considered alongside any changes that need to be made in the curriculum. A mixed economy. None of the techniques described is a panacea for specifying learning outcomes. It is likely that the development of an appropriate set of learning outcomes will require the use of a combination of different methods.